In the fast-paced world of medicine, sharing knowledge is paramount. Each patient or healthcare success, each challenge overcome, holds a lesson for us all. But how do we effectively share these lessons? How do we ensure our experiences translate into better care for all? This is where SQUIRE comes in. SQUIRE stands for Standards for Quality Improvement Reporting Excellence. It's a guide, a framework for sharing our quality improvement work. Imagine a world where every hospital, every clinic speaks the same language of improvement. With SQUIRE, this vision becomes a reality. By using a common format, we can better understand each other's efforts and facilitate collaboration across disciplines. We can learn from both successes and failures. SQUIRE is not just about reporting. It's about learning and growing together. It's about building a safer, more effective healthcare system for everyone. It is a common language or toolkit used to share knowledge. When we share our quality improvement projects using SQUIRE, we contribute to a global library of knowledge. This shared wisdom helps us avoid repeating past mistakes. It allows us to adapt successful strategies to our own settings. Ultimately, SQUIRE empowers us to provide better care for our patients. SQUIRE 2.0 is the latest version of these guidelines. It's designed to make reporting even clearer and more effective. It helps others understand what you are doing. Think of it as a roadmap, guiding you through the process of sharing your quality improvement project with the world. This roadmap is divided into key sections, each with a specific purpose. Introduction. This is where you set the scene, introducing your project and its importance. Methods. Here, you detail the steps you took, making your work easily understandable and replicable. Results. This section presents your findings, highlighting the impact of your improvement efforts. Discussion. Finally, you analyze your results, discussing their implications and future directions. These core components work together to create a complete and transparent picture of your project. This clarity is essential for others to learn from your work and potentially implement similar improvements in their own settings. Remember, the goal of SQUIRE is to spread knowledge and drive positive change in healthcare. Every quality improvement journey begins with a problem, a gap between what is and what should be. The first step in using SQUIRE 2.0 is clearly defining this problem. What issue are you trying to address? Why is it important to improve this particular area of care? Next, paint a picture of the context. Describe the setting of your project. Is it a busy urban hospital or a rural clinic? What are the unique challenges and resources of your environment? This information helps others understand the specific factors influencing your work. Imagine you're trying to reduce hospital readmissions for heart failure patients. Clearly state this goal and its significance. Then describe your hospital's unique characteristics, such as the size of your cardiology team or the socioeconomic status of your patient population. By providing this context, you help readers understand the complexities of your project. This understanding is crucial for them to accurately interpret your findings and apply relevant lessons to their own work. Section 4, building the foundation, knowledge, rationale, and intervention. With the problem and context established, SQUIRE 2.0 guides you to build a solid foundation for your project. First, share the existing knowledge. What do we already know about this issue? What have others tried before? Next, explain your rationale. Why did you choose this particular approach to improvement? What evidence or theories informed your decision? Finally, describe your intervention in detail. What specific changes did you implement? What tools or strategies did you use? Let's return to our heart failure example. You might discuss existing literature on medication adherence and its impact on readmissions. You could then explain why you chose to implement a patient education program focused on medication management. Clearly articulating your intervention, including its components and implementation steps, is crucial. It allows others to understand exactly what you did and how you did it, paving the way for replication and adaptation of your work. Section 5. Unpacking the process. Study methods in SQUIRE 2.0. The methods section of SQUIRE 2.0 is where you unpack the process of your quality improvement project. Think of it like a recipe. You need to provide a clear list of ingredients and step-by-step instructions so others can follow your lead. Start by describing your study population. Who did you include in your project? How did you recruit participants? Next, outline your data collection methods. What information did you gather and how did you collect it? Were there any specific tools or surveys you used? For instance, you might describe how you identified eligible heart failure patients being discharged from your hospital. You could then explain how you collected data on their medication adherence through follow-up phone calls and electronic prescription refills. By providing this level of detail, you ensure transparency and replicability. Others can understand your methods and potentially adapt them to their own settings. This transparency is essential for building a culture of learning and continuous improvement in healthcare. Section 6, sharing the outcomes, results that matter. The results section is where you present the fruits of your labor. This is where you share the impact of your quality improvement efforts. But remember, it's not just about presenting numbers, it's about telling a story with your data. Start by presenting your baseline data. What was the situation before you implemented your intervention? This sets the stage for understanding the impact of your work. Next, clearly present the changes you observed after implementing your intervention. Did readmissions decrease? Did medication adherence improve? For instance, you might show a graph illustrating the reduction in heart failure readmissions after implementing your patient education program. You could also present data on improvements in medication adherence rates. Remember, the goal is to present your findings clearly and objectively. Let the data speak for itself, allowing readers to draw their own conclusions about the effectiveness of your intervention. Section 7, making sense of it all, the discussion section. The discussion section of your SQUIRE 2.0 report is where you step back and make sense of your findings. It's not enough to simply present the results. You need to analyze their meaning and implications. Begin by summarizing your key findings. What were the most important outcomes of your project? Did you achieve your intended goals? Next, discuss the strengths and limitations of your study. Were there any challenges you encountered during implementation? Are there any factors that might have influenced your results? For example, you might acknowledge that your study was conducted at a single center and may not be generalizable to all hospitals. You could also discuss any unexpected challenges you faced, such as difficulty engaging certain patient populations. Finally, end with a call to action. What are the next steps for this work? What are the broader implications of your findings for healthcare practice and policy? By providing a thoughtful and balanced discussion, you encourage further dialogue and exploration of your findings. This open dialogue is crucial for advancing the field of quality improvement and translating research into practice.